Hello, my name is Annabelle Jenkins, and this is my presentation on vegetarian diet effects on neonate weight. So the objectives for this presentation are as follows: background information and definitions about all terms that pertain to this specific topic. Next, we have potential differences between the birth weights of neonates depending on their mother's diets. These diets can vary from vegan, vegetarian, and non-vegetarian. When it comes to the vegetarian diet, there are different variations that might be specified for specific studies. Next, we'll have the prevalence of low birth weights of neonates who are born to vegan and vegetarian women. Next, we will be determining whether or not a vegan or a vegetarian diet is safe for women to adhere to while they are pregnant with a child. And lastly, we will summarize the findings and detail if there are any steps that need to be taken by mothers if they were trying to follow a vegan or vegetarian diet to ensure that their child gets the quality nutrients that they need so that they can prevent low birth weights. For background information, a vegetarian is someone who does not consume meat. As I previously stated, there are variations to this diet style, such as pescatarian, lacto-ovo-vegetarian, lacto-vegetarian, ovo-vegetarian, and many more. A vegan is someone who does not consume meat or animal products. So they are similar to a vegetarian, but they also don't consume animal products such as dairy products or eggs. A neonate is a newborn child who is under 4 weeks old. A low birth weight is categorized as a neonate weighing less than 2,500 grams. A low birth weight is known to lead to other issues and complications. Some complications examples are infections, developmental issues, etc. And it is drastically impacted by the diet and the behaviors of the mother both before and during the pregnancy. Here are some factors that may affect birth weight. First, we have vitamin 12, homocysteine, and MMA levels. All of these are found to be off depending on diet. Pre-pregnancy BMI was found to be lower for vegetarians than non-vegetarians. That is something that can affect birth weight, and so can a reduced gestational weight gain, which is weight that is gained by the mother during pregnancy. Also, a lower protein and zinc intake than non-vegetarians was found in vegetarians. So a lower protein level and a lower zinc can also lead to a lower birth weight, or at least affect the birth weight of the neonate. Preterm delivery is also something that may affect birth weight. A low consumption of seafood related to a substantial risk of low birth weight in preterm delivery was found by a study done in Denmark. This means that the low plasma concentration of EPA and DHA during pregnancy led to a high amount of preterm deliveries, which when a baby is preterm, it is also low in birth weight. Differences in birth weights. Vitamin B12 levels are found to be associated with low birth weights when measured in the first and second trimesters. This was found to be true by a meta-analysis from Norway. The same meta-analysis found that B12, homocysteine, and MMA levels of mothers did not convey a correlation with birth weight or gestational age when measured postpartum. As I previously mentioned that B12, homocysteine, and MMA levels might affect birth weight, this meta-analysis found that when measured postpartum, there was not a correlation. Vegetarians were also associated with smaller neonatal size, vegetarian mothers were. So it was found that a smaller neonatal size was linked to mothers who followed a vegetarian diet. But a vegetarian diet for mothers was not associated with morbidities or other negative maternal outcomes. This quote states, "Vegetarian diets during pregnancy exerted no substantial effect on birth weight." And notice how this quote mentions substantial effect. We'll find later on that some studies have found slight differences in birth weight, while others have found strong differences. Prevalence. A Danish observational study which had a high number of mothers where 98.7% of the participants were defined as omnivorous, meaning they eat meat and plants. 1%, 0.3%, and 0.03% defined themselves as fish or poultry vegetarians, also known as pescatarians. The 0.3% identified themselves as lacto-ovo-vegetarians, and the 0.03% identified as vegans for this study. This study found that compared to omnivorous mothers, vegans had a higher prevalence of preeclampsia, and their offspring had an average 240 grams lower birth weight than omnivorous mothers. So this study has found that vegan mothers did have a higher prevalence of lower birth weight when compared to omnivorous mothers. Another study that was an observational study found that vegans had a lower birth weight compared to lacto-ovo-vegetarians. And as you can see, this is in grams, the differences for vegans and lacto-ovo-vegetarians for the weight of the neonates. Vegans' range was 3,015 grams plus or minus 420 grams, while lacto-ovo-vegetarians were 3,285 plus or minus 482 grams. Vegan mothers who gave birth also had lower birth weights compared to omnivores who had neonate weight of 3,328 plus or minus 495 grams, but not a lower birth weight when compared to fish eaters. One study found that there was a slight but also insignificant difference between the birth weights of vegan, vegetarian, and non-vegetarian mothers. That is shown in the graph to the right. This graph shows that on the left in green, the vegan this is like the average weight of the infants born to women adhering to a specific diet group. So the vegan mothers illustrated in the green graph, their average weight for the neonates was 3.4 kilograms. The middle graph in blue is the vegetarian mothers, whose neonates had an average weight of 3.38 kilograms. And finally, on the right were the non-vegetarian mothers, and their neonates' average was 3.32 kilograms. So this found that there was very slight difference in the weight of neonates depending on the mother's diet. And it found that they found that a maternal vegan diet was associated with lower birth weight than non-vegetarians. Another study showed mean birth weight centiles. Mothers who were adhering to vegan diets showed this data, and non-vegetarian mothers had this data. So this is clear that the vegan mothers gave birth to lower weight neonates. So the big question is it safe for mothers to adhere to a vegan or vegetarian diet while pregnant with child? It was found that a balanced maternal nutrition during pregnancy is imperative for the mother's health status and consequently for offspring, and is crucial to maintain an adequate environment for optimal fetal development. So, this goes for any mother, no matter what diet they may follow. It's important for a mother to have a well planned diet, especially if they are vegan or vegetarian. It is crucial for them to get the important nutrients such as protein and vitamin B12. The vegetarian type pattern should be considered safe, and it is not associated with preterm birth weight, or SGA if the requirements are met. But since requirements are oftentimes not met, it is found that vegan and vegetarian mothers, neonates, have lower birth weights than other mothers. In summary, there are many concerns when it comes to nutritional status of pregnant women regardless of their diet, whether they're vegan, vegetarian, or non-vegetarian. So there is an association between maternal vegetarianism or vegan diets and low birth weights among neonates. This is clear because there is certain nutrients that is not consumed when mothers are following vegan and vegetarian diets. But this can be combated with a well-planned and nutritious vegan or vegetarian diet. If doctors are able to provide their patients who wish to adhere to a vegan or vegetarian diet with a well laid out plan so that they can consume all necessary nutrients or use supplements that can help combat low birth weights and other complications that might be associated. Thank you.